No one tells you this in your regular checkups. They'll talk about cholesterol, blood pressure, maybe even prostate exams, but they'll never ask, have you completely stopped touching yourself? And yet, what they don't say might be costing you more than you realize if you're over 60 and you've quietly let go of self-intimacy, believing it's just something young men do. Your body could already be breaking down in ways you're not aware of, subtle at first, but deeply damaging. Over time, this isn't locker room talk or some awkward conversation. It's science, because the act of self-stimulation, yes, even in your 60s, 70s, and beyond isn't just about pleasure. It's about circulation, hormone balance, prostate function, sleep quality, mental clarity, emotional stability, and even your immune system that you see as a men's health specialist with over 3 decades of experience. I've witnessed the same silent mistake repeated over and over. Good men giving up a powerful form of care because they thought it was no longer age appropriate. But what if I told you that the real danger isn't in doing it, it's in stopping? Stay with me. Because in the next few minutes, you'll discover what truly happens to your body, mind, and sense of self when you abandon self-touch in your later years, and how one small change could restore far more than you ever expected. Let's start with what may be the most overlooked consequence of giving up self-intimacy as you age. The slow breakdown of your prostate and urinary health. It begins quietly. A few more bathroom trips during the night, a weaker stream, a subtle pressure in your lower abdomen you can't quite explain. You brush it off, just getting older. You think, but inside, your prostate may already be struggling. One patient of mine, a sharp and healthy man in his early 70s, once said, "Doc, I just figured I didn't need that part of my life anymore." What he didn't realize, and what most men don't, is that ejaculation, even through masturbation, is essential to keeping the prostate functioning properly. Your prostate isn't a passive gland. It's a dynamic organ-producing fluid, expanding, contracting, and like any muscle or system in the body, it suffers when neglected. Without regular stimulation, prostate fluid stagnates. That stagnation becomes a breeding ground for inflammation, swelling, and pressure buildup. The result: disrupted urination, nighttime urgency, that uncomfortable sensation of never fully emptying your bladder. And if left unchecked, it can progress into benign prostatic hyperplasia (BPH), a condition that affects nearly 50% of men. Over 60, BPH may sound clinical, but its consequences are painfully real: urinary retention, bladder infections, and in some cases, the need for catheters or surgery to relieve pressure that could have been managed with one simple, natural habit: regular ejaculation. In fact, studies have shown that men who ejaculate 21 times or more per month have a significantly lower risk of developing prostate cancer than those who don't. This isn't about fantasy. It's not about chasing youth. It's about function, biology, preventive health. When you stop masturbating in old age, you're not just ignoring pleasure, you're inviting pain, inflammation, and a loss of control over one of your body's most essential systems. I've seen proud CAPABLE men become anxious about leaving home because they no longer trust their bladder. I've seen them map their daily routines around bathroom proximity, not because of old age, but because of neglect. And the worst part, most of them didn't know this could have been prevented. They never had a doctor tell them that self-stimulation is more than okay, it's vital. So if you've noticed those late-night trips increasing, or that quiet pressure lingering, don't write it off. It may be your body's way of saying, "I need this. Don't give up on me yet." Not long ago, a man in his late 60s came to see me not for urinary trouble, not for pain, but for something harder to describe. He sat down, folded his hands, and said quietly, "Doc, I don't feel like myself anymore. He wasn't talking about depression. He was talking about mental fog, that heavy cloud that makes you forget what you walked into a room for, lose your train of thought mid-sentence, or struggle to focus on a conversation you used to enjoy. Is this just aging? He asked Dot, and here's what I told him. Not entirely. Yes, aging brings natural cognitive changes, but what many people don't know is that sexual activity, including masturbation, plays a vital role in protecting brain function. When you engage in self-stimulation, your brain isn't just chasing pleasure, it's releasing a powerful cocktail of neurochemicals. Dopamine for motivation and serotonin for mood stability, oxytocin for emotional bonding and focus. These chemicals don't just make you feel good, they nourish the brain, increase blood flow, reduce cortisol, the stress hormone, and help reinforce neural connections that keep you sharp, centered, and mentally alive. Now, imagine your brain going months or even years without that stimulation. The chemical surges slow, the connections weaken, cortisol rises, and slowly that fog creeps in. You begin to forget names. You lose interest in reading. You stop showing up to your chess club, your book group, or even Sunday coffee with the neighbors because you're afraid you won't remember people's names or follow the conversation. And here's what makes it worse: low testosterone. When you stop engaging in sexual activity, your testosterone levels can drop faster. And this hormone isn't just about sex, it affects your focus, confidence, decisiveness, and mental resilience. Some studies have even begun linking reduced sexual activity in older adults to early cognitive decline and increased dementia risk. That doesn't mean stopping masturbation causes Alzheimer's, but it does mean that the lack of stimulation, emotional release, and hormonal balance makes your brain more vulnerable. I've seen men begin to doubt their minds not because of disease, but because their brains are understimulated. And that doubt, it becomes fear. That fear becomes withdrawal, and withdrawal becomes isolation. But here's the good news. It's not irreversible. When you reintroduce healthy self-stimulation even just a few times a week, you trigger those protective brain chemicals again. The fog begins to lift, focus returns, your thoughts sharpen. You feel more grounded, more aware, more like yourself. Because mental clarity isn't only found in puzzles or supplements. Sometimes it starts with your body and a decision to reconnect. He sat in front of me, shoulders slumped, eyes dull, voice almost flat, a retired widower in his early 70s. He wasn't there for chest pain or back trouble. Instead, he said something that stopped me in my tracks. I don't feel anything anymore. Not sadness, not joy, just nothing. Is that normal for someone my age? That question haunts me, because I hear it more than most people would believe. And here's the truth. What many assume is just aging is often a deeper form of emotional shutdown, quiet, creeping depression. But unlike the dramatic episodes we see on TV, depression in older adults often wears a disguise. It looks like fatigue. It sounds like I'm fine. It feels like disconnection from the world and from yourself. And in many cases, it begins with the loss of self-intimacy. You see, masturbation isn't just a physical act. It's emotional release. It's your body's built-in way of managing stress, pain, and loneliness, especially in the later stages of life when other outlets may be fewer and farther between. During climax, your brain releases powerful chemicals like oxytocin, the bonding hormone, endorphins, the body's natural painkillers and mood boosters. These chemicals help regulate emotion, ease anxiety, and restore inner balance. Without that release, especially during times of grief, isolation, or stress, you risk emotional numbness, and over time, that numbness often evolves into depression. I've seen it firsthand. A man loses his spouse. He stops engaging with his body. Days become quieter. Sleep becomes restless. Meals lose their flavor. Hobby gather dust out at first. It just feels like he's slowing down, but eventually he forgets what it felt like to feel alive. And the worst part, he doesn't even realize what's happening. Because no one told him that neglecting this part of himself could take such a toll. And that's the cruel irony. We think giving up self-touch is the mature thing to do, when in reality, it might be the very thing keeping our emotional health intact. I've watched patients rediscover a spark not from medication, but from reclaiming a connection with their own body. One man said, "Doc, I didn't realize how numb I'd become until I started feeling again." So let me be clear, your body is not too old to feel, your heart is not too old to care, and you are not too old to deserve connection even if it starts with you, because in choosing to reconnect, even privately, even gently, you're not chasing pleasure, you're choosing presence, you're saying, "I still feel, I still matter." And that, my friend, is emotional survival. He looked exhausted, a man in his late 60s. Once vibrant and active, now pale, restless, and barely making it through the day. "Doc," he said, "I fall asleep, but I wake up like clockwork at 2 a.m. mind. Racing, body tight. I just lie there, waiting for morning." His blood work looked fine. No apnea. No medication side effects. But when I gently asked about his intimate life, he looked down and muttered, "That part of me is over." What he didn't realize, and what most men don't, is that a quiet, natural sleep aid has been missing from his routine all along. Healthy sexual release, you see. Sleep isn't just about being tired, it's a hormonal process. And one of the most effective ways to signal the body to rest deeply is through orgasm, yes. Even through solo activity. During climax, your body releases oxytocin, lowers stress, induces prolactin, triggers drowsiness and deep sleep endorphins, relax muscles, and ease tension. Cortisol, the stress hormone, drops significantly, aren't theories. This is hardwired biology. Now imagine going weeks, months, or even years without that natural release. Your nervous system stays on high alert. Cortisol builds up. Your mind races at night. Your muscles remain tense. And true rest becomes elusive. The result, you toss, you turn, you wake up unrefreshed, and over time, that exhaustion takes a heavy toll. That poor sleep in older adults doesn't just mean feeling groggy. It increases your risk for cognitive decline, weakened immunity, mood disorders should disease falls, and accidents, and a quiet erosion of independence. I've had patients who slowly withdrew from social life not because of illness, but because they were too tired to function, too drained to drive, too exhausted to enjoy their own lives. And here's what's heartbreaking. Many never realized that what they were missing wasn't in a pill bottle but in their own body's natural rhythm. Something as simple as reconnecting with self-pleasure, not for lust, but for restoration, could have made all the difference. One patient told me after beginning this simple practice again, "Doc, I sleep like I did 30 years ago. I didn't know how much I needed that release." Too many men confuse biological neglect with getting old, and they suffer in silence. So if you're lying awake at night, staring at the ceiling, mind buzzing and body rigid, don't just accept it. Ask yourself, when was the last time I truly let go? Because sometimes what your body needs isn't a sleep aid, it's a signal. A message that says, it's okay to rest, you're safe now. A few years ago, I met a retired firefighter in his early 70s, a strong, disciplined man who had spent decades putting his body on the line. But now, he looked at me with quiet concern and said, "Doc, I feel like the foundation of my body is crumbling. I leak sometimes. I can't stand too long without pressure in my hips and lower back. I don't know what's happening." What he was describing wasn't just age. It was the gradual weakening of his pelvic floor and circulation system, something most men don't even think about until it's already affecting their lives. The pelvic floor is a group of muscles at the base of your body. It supports your bladder, bowel, and sexual organs. When these muscles are strong and active, they maintain control, stability, and even help with posture. But when they weaken, everything changes. What most men don't realize is that sexual stimulation, including masturbation, is one of the most effective natural workouts for the pelvic floor. During arousal and orgasm, these muscles contract rhythmically, pumping blood through the region, keeping tissues elastic, and activating the nerves that control bladder and erectile function. This isn't about pleasure, it's preservation. When you stop engaging with this part of your body, these muscles begin to atrophy, blood flow slows, nerve signals weaken, tissues stiffen, and you may start to notice frequent urges to urinate, small leaks when coughing, or laughing difficulty holding gas lower back, or hip discomfort, loss of sensation, or responsiveness during intimacies might seem like minor inconveniences at first, but over time, they chip away at your freedom. I've seen once independent men begin avoiding social events not because of age, but because they no longer trust their bladder. Others grow embarrassed by unexpected leaks or the quiet shame of physical decline, and sadly, many don't know this is preventable. Regular sexual activity, even solo, keeps the pelvic floor alive. It maintains circulation to your most sensitive regions, preserves nerve health, and reminds your lower body that it still matters. This isn't vanity. It's function, it's mobility, it's dignity, because when these muscles give out, the consequences can be devastating. False urinary incontinence, erectile dysfunction, a quiet retreat from life, but it doesn't have to get to that point. You don't need machines, surgeries, or even a gym. You just need to send your body a message. You're still needed. You're still connected. You're still alive. Because when you reclaim this simple habit, you're not just activating pleasure. You're restoring strength. At the foundation of who you are, it was the middle of winter when he walked into my office, slumped, pale and tired of being tired. A man in his late 60s who would always bounce back fast. But this year, Doc, he said, every cold knocks me out for weeks. I can't seem to shake anything off anymore. His diet was decent, his sleep fair, no major health conditions on paper. But when I gently asked if he remained sexually active even just with himself, he hesitated, then smiled uncomfortably. Nah, that part of him's just retired. What? He didn't know, and what most men don't, is that sexual activity, including masturbation, has a direct, measurable impact on your immune system. This isn't myth. This is biology. During arousal and orgasm, your body doesn't just release feel-good chemicals, it also produces immune-boosting agents, like immunoglobulin A, your body's first line of defense against infection. Endorphins reduce inflammation and promote healing. Dopamine and oxytocin lower cortisol, the stress hormone that weakens immunity. When elevated, these chemicals work together to strengthen your natural defenses, protect your respiratory and digestive systems, and keep inflammation, the silent destroyer, under control. But when sexual activity disappears from your life for extended periods, your body loses access to these vital immune signals, and the result, more frequent cold, slower recovery from minor infections, lingering fatigue, a risk of inflammation-related disease, and a general sense that your body is no longer fighting back like it used to. One of my patients, widowed in her early 70s, hadn't touched herself in 5 years. She was always run down, catching every virus. Nothing seemed to work. We talked openly about reconnecting with her body, not out of lust, but for wellness. Months later, she returned with brighter eyes and renewed energy. I don't know what changed, she said, but I feel like my body is working with me again, not against me. That's not magic. That's what happens when you reawaken. Your own internal pharmacy, the one that's built into your biology. You see, your immune system doesn't care about embarrassment. It doesn't care about age or social stigma. It only responds to what keeps it strong, and sexual stimulation is one of those things. So if you've noticed yourself getting sick more often, if small infections linger too long, or your energy never quite returns, ask yourself, am I giving my body the signals it needs to stay resilient? Because sometimes the best immune support doesn't come from a bottle, it comes from you. If you've stayed with me this far, I want to speak to you directly, not as a doctor, but as someone who's walked beside thousands of men just like you. Strong men, honest men, men who've carried the weight of families, careers, and silent sacrifices. But somewhere along the way, maybe you stopped seeing yourself fully. Maybe you've let go of the part of you that still wants to feel not just alive, but connected, present, and worthy. And I'm here to tell you, it's not too late, not even close. Your body hasn't given up on you. It's still listening, still waiting. All it needs is a signal that says, I still care, I still count. Sometimes that signal comes not from appeal, but from a moment of reconnection with yourself. Taking care of your body isn't just about longevity, it's about dignity. About showing up for yourself, not because you're broken, but because you still matter. And self-care isn't selfish. It's a form of respect for the life you've lived and the life you still have left. If these messages touch something in you, let me know in the comments. What part hit home? And if you want more honest, science-backed advice made for men like you, hit that subscribe button and turn on the bell, because this isn't the end of this story. This is your return to strength, to presence, to feeling whole again. You're still here, you're still strong, and your best days may not be behind you. They might just be waking up.